from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hey everybody, welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we continue our behavioral health mini-series. Today we'll be discussing mental health in the aging population. Our guest today is Jacqueline Carlson, the Director of Nursing at the Cornell Behavioral Health Pavilion at Sarasota Memorial. Jacqueline, thank you so much for joining us.
Yeah, thanks for having me. Happy to be here.
Sarasota is known for its active aging population. How does that shape our community's healthcare needs?
We're very fortunate to be a popular destination for retirement. We have a large percentage of our population that's over 65. So for us, that means just making sure that we have the resources and services available that align with that population. Aging is just a normal part of life. Certainly doesn't mean that it's more challenging, just different. So making sure that we have services readily available to meet them where they're at is important.
What are some common misconceptions about aging and mental health?
I think one of the big ones is just that as we get older, it's normal to lose our memory. There's a little bit of a stigma with an older person, right? Like their abilities are less, or they need more help, or cognition is the big thing, right? Like we get slower, we forget things. I think that's the most common misconception, and that's normal, right? It's normal to start losing your memory or fading, and that's not really.
Why is it important to challenge the idea that depression, anxiety, loneliness are just part of getting older?
Yeah, so because it's really not. So retirement is another phase in our life, right? Whether that's retiring from a job, or now your kids are older and they've gone off and they're living their own life. Being depressed and anxious about that isn't normal. Like that's not just part of aging. It's something that you should take note of, and just don't ignore it. If you notice that something's changing with somebody that you care about, that's something to address.
But as people age, some cognitive or physical slowing is to be expected. We can't be young forever.
Right.
What are the red flags that may indicate it's actually a mental health issue that requires intervention or more help?
Yeah, so mental changes are more acute or sudden, if you will, right? So when we talk about an actual like neurocognitive disorder, that's very slow. It's a very slow progression. There's various types, and some are a little faster, but with mental health, those are more acute changes, right? So suddenly somebody's maybe not engaging with you like they normally would have, or they're not doing the things that they normally would do, or hey, I haven't heard from so-and-so in a long time, that's weird, those types of things. It's important not to ignore that. And also just naturally, depending on an individual situation, you naturally sometimes end up isolated, right? So like if you are retiring down here, let's say, and all of your primary family is back north, you might not have as frequent contact with them, so you might not notice that. So it's easy to miss too.
One startling fact that I read is that men over the age of 75 have the highest suicide risk. What can families and communities do to respond to that?
Yeah, so again, the big thing is not ignoring any troublesome signs, like things that you identify that are abnormal for them or out of character for them, right? Again, they seem maybe like more tired, or they're saying I'm tired all the time. That's not necessarily normal. There's subtle signs, and in the geriatric population, depression manifests differently, right? Like just generationally, how we express our emotions or talk about them, they don't necessarily, right? So it's important not to ignore subtle signs of depression that can be even pain, like they're now complaining of pain. Fatigue is another one. They seem like they can't pay attention very well. So like being aware of those signs and just being aware of that risk factor in itself, that over 75, there's all of these things that play into depression and anxiety. And I think just really being aware, making sure that they go to like yearly appointments and being proactive, making sure they're staying connected, like people that are not connected. So keeping those things in mind as a family member, even just like, hey, what have you been doing? Are you getting out of the house? What are you involved in? Really staying engaged with them and knowing what's going on with them.
And I think that's such an important point about that generationally, maybe younger generations have become more comfortable discussing and naming some of those concerning feelings, depression, anxiety, that maybe older generations were not as comfortable with discussing.
Mm-hmm.
So that's a really good point.
Well, and just they don't want to be a burden. That's another thing. Like very commonly, this isn't necessarily even generational. Many people are like, I don't want to bother other people with my problems, right? So I think normalizing talking about your feelings is very important. Not, trying to encourage it the best you can. And men particularly are a little more stoic. I mean, not all, but in general, men tend to be more stoic, which puts them at a greater risk. But I think just bearing that in mind, 75, male, males in general are at higher risk. So,
can you walk us through the difference between normal age-related changes and warning signs of depression and anxiety? You talked about some of those with the fatigue and things like that, but how do you differentiate between what's normal? This is a 80-year-old person and they're tired, they're not as active as they used to be, versus this is true fatigue. This is maybe a mental health situation. How do you differentiate, and what are the signs that caregivers should never overlook?
Yeah, so one thing again is the like chronicity, so like how fast that happens. If it's like an acute change, a sudden change, that's not necessarily an aging process. Aging processes are pretty slow. And when we talk about normal cognitive decline or aging, it's more like you're a little forgetful or you're a little, right? It doesn't change their engagement or like things that they're doing or things that they enjoy doing. Like if you see somebody suddenly not going to their church, or they're like they normally go to church every Sunday, where have they been, and they're not doing that anymore, or they're involved in their community and they're not doing that, or even just in their own families, like suddenly they're not making those phone calls, or they're not going to events, or they're all of those things. Like any change in from their normal pattern of behavior is a warning sign that should be addressed.
How can caregivers, family members, advocates for these patients help encourage the screening for both dementia and depression when they start noticing those memory or cognitive issues, to ensure that maybe a physician who doesn't know them as well or something isn't just trying to say, oh, I think this is dementia, or oh, I think this is depression? How do they make sure that they have the conversation so they're tested for both?
Yeah, I mean, knowledge is power. So like having that, just knowing that as a family member, that really, so basically like 15% of people that get referred for dementia, or like families like, oh my gosh, they're cognitively declining, 15% of those are depression. So it's important to just voice that too, like again, making sure that they're going to their yearly appointments, because that's something that gets screened out when they go in. But sometimes having somebody present that knows them is important too, because again, many people don't want to share that, so they'll go to an appointment and they'll answer no to all the questions. I'm good, everything's fine, when really like this can be an insidious thing. And so having somebody at the appointment with them, advocating and saying, hey, this is kind of what we've been seeing. I don't think mom sees this or dad sees this, but this is what we're seeing. They're not taking care of themselves, maybe they're not showering, they're not eating, they've lost a little weight, all those things.
And how is depression treated in this population?
Right. So, I mean, the first line of defense really is therapy. That is a proven outcome. If somebody's in a real crisis, you want to get help right away. Lots of facilities have crisis lines or walk-in where you can be evaluated right away. Cornell here has that where we're open 24 hours. You can be assessed at any time. If you're really concerned, you can do a wellness check. Like say you are out of state and your loved one is here, it never hurts to have call law enforcement and have them do a wellness check on somebody too. If you have any doubts, it's always just best to follow up. Don't think about it. If you have any question, if you're ever concerned, just follow through. There's no harm in having somebody evaluated. But therapy is first line. There are medications, but we really do try to, get them engaged. Going to therapy is one way to do that. Group therapy is also a great way because again, it's all about connectedness. Like if I could just get one thing out, it's all about staying connected. At any phase in your life, being connected with other people, that purpose-driven life, if you will, like having that sense of purpose and being around other people is so important.
Something else that's related to that is my understanding is that it's important to also treat hearing loss because hearing loss can play a big impact in not having that connection.
Yes.
Mom or dad or grandma, grandpa, please make sure you're wearing your hearing aid, like stay connected.
Yeah, that's very true. People will avoid even events or functions because they know they really can't hear, or they don't say anything because they can't hear. But the hearing loss piece that's a very important piece. Yeah.
How can medications or alcohol use complicate mental health treatment in older adults?
Yeah, so alcohol is a system depressant. Having a glass of wine here and there, that's not problematic, but alcohol actually makes you feel more depressed. And there's even some medications. So as we get older, we start taking blood pressure medications or things like that. Some beta blockers even can make people feel depressed. So it's really important too, like when you do go to these appointments, that list all your medications, that you're aware of what those side effects are, right? And just being very mindful of, again, your physical health and your mental health are very entwined. So staying active and engaged and even like volunteering, like finding activities where you volunteer and it's like more of a physical job or, those are all great ways to stay ahead of that too.
Can it be more difficult to treat anxiety and depression in this population because of other medications they're on?
Yeah, so again, that's sometimes difficult to sift out, but really having a good relationship with your primary care physician and taking note, keeping track, doing a mood diary, especially if you're doing any kind of medication adjustments, because even just adjusting a medication or increasing it, maybe you didn't have any issues with it and now we increased your propranolol or whatever, and now you've noticed that you're feeling a little more stuck in the mud or a little more down, or it's important to keep track of those things and share that with your primary care physician for sure.
What are some simple ways seniors can stay mentally and emotionally healthy? Simple things that they can start, because oftentimes if you just say, I'm going to be more active and I'm going to go to a lot, it seems overwhelming. So what are some small ways they can implement immediately?
Yeah, even just like going outside of your house, going for a short walk, that can be a block. Mm-hmm. Going to a library, doesn't have to be necessarily where you're going to a gym and, doing silver sneakers and I'm running and I'm swimming and those are great, but you could go to a mall and walk around in a mall. Like it doesn't even have to cost you any money, just getting out of the house. Even volunteering can seem overwhelming, but there's a lot of ways to volunteer that are very easy. Not everybody's a social butterfly, so it's important to find activities that speak to you, right? Like if you pick something, you're like, I'm not really going to do that. It's okay. Be honest with yourself and find things that that you will like to do. Again, that can be just you can go to a park and and just sit. And that's just getting you out and getting you out in the sun and getting you out in the daylight. And, obviously we want people to connect with other people because that's really proven to be the best thing. But even having a pet, sometimes that can be a chore too, depending on where you're at in your life, right? But all those things, again, gives you that purpose and connectedness.
What kinds of mental health care options are available locally for seniors, and how accessible are they?
Yeah, so there's numerous outpatient clinics, and now even you can do things remotely, right? You don't even have to leave your house. Not ideal if you have a mental health disorder, but accessible depending again on your ability to get out of your house too, right? So there's a lot of options for like online groups, even individual therapy. They do that online too. Again, technology's sometimes not everybody's friend, but outpatient wise, you can go in person. Even here at Cornell, we have like free groups there that people can attend. And again, it's about that connectedness. But again, your primary care physician is a good place to start if you don't know where to go. And crisis situations, if you are feeling bad, 211, you can always call and they'll get you connected as well.
Can you talk about some of the groups at Cornell Behavioral Health Pavilion? Because they really are very unique.
Oh, yeah. So we have our Thrive 55 group. We have a great therapists there. Our outpatient therapists are amazing. And so on Tuesdays from 1:30 to 2:30, it's the Connect group. And they, it's about coping skills and connecting. And then the other group that we have, it's also free, is the also a coping skill and support group. And they also meet weekly every Friday from 1:30 to 2:30.
Why is it so important to have opportunities like that? And what have you guys at Cornell seen from starting some of these groups?
Yeah, I mean, it's one of the main things is just knowing that you're not alone. Lots of people experience those things. It's not a weakness. It doesn't mean that you're not doing what you're supposed to be doing. Sometimes just through the natural course of our lives, we slowly distance. Again, you move down here, maybe you don't have as much family here. It's not always easy to get out and be around other people, depending on how we're built, right? Not everybody's a social butterfly. So it's important to be very cognizant of that and be purposeful in what you're doing every day. And telling yourself, like making yourself a schedule, like I'm going to go to the library 3 days a week and read, or I'm going to volunteer at the hospital, or I'm going, like very purposefully adding those things into your daily life so that you don't ignore that piece. Mental health is health. So if you can do everything right physically, but if mentally you're not in a good place, it really can kind of sneak up on you. So, this is a very active community, but there's things in every community. If you look, you can find things.
What should someone do if they noticed a loved one struggling, but that loved one is resistant to getting help? Maybe it's one of the stoic people you mentioned. Maybe it's someone who says, "Oh, I'm fine. What do you do?"
I mean, those are gentle conversations to have, because sometimes the more you push, the further they can go the other way. And so just being non-judgmental, offering, like, hey, do you want, how about we go do this? Do you want to go do this? What would you like to go do today? Or sometimes it's not even asking, like, hey, I'm going to pick you up. We're going to go to dinner or something like that. Gradually, working them into a place where they will go get help, but just staying engaged with them, just because they're not calling you, give them a call and make sure that they're doing okay. Because ultimately, yeah, you can't force anybody to do anything, but primarily if you're worried about somebody, just don't wait, just have somebody check on them and get them assessed.
So you've talked about a number of different things today, but I want to ask you if there's one message with families or caregivers that are worried about senior mental health, what would you tell them?
Just get them connected. The connected piece is most important. If you're worried, just follow through. They might get mad, but it's okay. It's an okay price to pay if you're worried about somebody, but make sure that they're very connected.
Great advice. Well, thank you so much for joining us.
Yeah, thanks for having me.
And for those of you at home, if you liked this episode of HealthCasts, please like and comment. And visit smh.com/podcast to listen to more experts talking about the health issues which matter to you. And for everyone in the Sarasota community, we encourage you to visit smh.com to get the latest from Sarasota Memorial. Have a great day.